Hello, life science class. This is the 19C Skeletal System section of our chapter, and we mentioned already yesterday when we were talking that our 11 body systems are divided up among the different chapters going through the end of our book here. And we've talked yesterday about the integumentary system, and today we're going to talk about the skeletal system. So, previously in our chapters, we looked at animals that had exoskeletons, right? The outside coating that's going to be protective. Our bodies don't have that outside exoskeleton. Instead, our skeleton's inside, right? We have a lightweight skeleton, it's strong, we have some flexible joints so we can bend and jump and move, have greater range of motion. Our body skeleton is meant to be a supporting framework, also is supposed to protect our organs, think about our lungs or our heart, right? The skeleton is also important for us because it's a store for minerals. Minerals that we can kind of stockpile and use when we need them. Inside of our skeleton, we have places that actually produce blood cells to replace blood cells that get old and worn out, right? We also have cartilage that's a part of our skeletal system. This is a connective tissue, but it's softer and more flexible than bone. It often covers the end of our bone and allows us to be able to grow and become more, grow larger and taller. The bone that's part of our skeleton is going to involve connective tissue and is what we call a living bone. We have non-living material that our cells in our skeleton also make, but the osteons are going to be a part of those bones that are considered living. Very few of our bones are solid. Most of them are going to have like a spongy material inside. That's called bone marrow, right? The marrow cavity contains bone marrow, has the red bone marrow and yellow bone marrow that are going to be part of making more blood cells for us. Our bone is broken down into a couple of other categories. First is called periosteum, and that is an important part of the bone structure that's going to be very sturdy. But we have a couple of words here, ligaments and tendons, that are also very important to keep our skeleton aligned and our joints from becoming overextended, right? So in our body we have ligaments, and it's going to be important for you to be able to remember what the difference is between a ligament and a tendon. When we talk about the bone that makes up our skeleton, those ligaments and tendons have different jobs. They're both important, but just different jobs that they do. So the job of the ligament is to be able to be like a tough connective material. It's going to attach bone to bone. So I would maybe write here next to ligament bone to bone, because that's part of the job there to give us some cushion in between our bones. The tendons, on the other hand, are going to be more like a stretchy band that's going to connect our muscle to our bones, so that the muscles can stay in one place. And sometimes if you get injured, say in a sports injury, you might do some damage to either your ligaments or your tendons. Okay, here's a picture of our skeleton, and later on we'll talk about some of the different bones that are part of our skeleton. Okay, a joint is a place where two bones meet, right? Think about your wrist as a joint, your elbow is a joint, your knee is a joint, right? And your joints are going to fall into different categories. One is called a hinge joint. Like I mentioned, your elbow or your knee can bend basically in one direction, right? You can have some injury that would cause that to be otherwise, but for the most part, your body wants to keep your elbow and your knee bending in one direction. We also have gliding joints, like the vertebrae in our back. They allow us to be able to kind of do a little bit more flexible sliding or moving, right? Ball and socket joint would be like your shoulder and your hip. This is going to give more of your 360 movement. That's going to help you, again, to be able to rotate more. We have a pivot joint between our bones in our hands and our feet, and in our lower leg. Between our radius and ulna, for example, allow us to twist our arm, right? That would be a pivot joint. Fused joints are joints in the skull. They're going to be joints that are meant to kind of give a little bit flexibility, but they don't move like the other types of skeletal structures that we have. One of the problems that can happen in skeletal joints would be arthritis. That's caused by inflammation around a joint. It can be very painful. Joints are capable of being surgically replaced. So if arthritis causes inflammation in, say, for example, a knee, or an injury causes problems such that you have no more cartilage in between those joints, and it's basically bone on bone, that can be very painful, right? So a doctor could replace that surgically to give a person better movement and more of the ability to go ahead and stay active. So this is the end of the skeletal section of our notes for today.